siblings, causing the transmission of increased because of waning immunity. So if you have somebody who's infectious, and they can pass on that to their little brother or sister who's only 2 months old. And the way to get around that really has been suggested by the CDC, that everyone get booster shots. Why aren't we sending our positively infected Ebola patients to specialty centres?
Should they not be allowed to get on planes?
I think so. You know, I think that we have to apply the quarantine of 21 days and limit activities. The medications he was on could have made him more suicidal. Now, I know there was no note indicating suicide, but he didn't have any religious or political issues making him do this from all accounts. Some people may say, well, why treat diabetics that are in the pre-diabetes phase? Well, they also found that people in the pre-diabetic phase also had high cholesterol and had high blood pressure, so it was worth screening for diabetes, even if it was early for the diabetes itself. Both the topics that we've been talking about today, the gene variations are small variations. There's not like a whole chromosome that's abnormal, a whole gene that's abnormal. These are variation in what we call SNPs.
What does it mean when someone's heart is older than their actual age, and how can you find out if you're one of those folks?
Well, you're certainly not young at heart, I can tell you. On the Ebola barometer, a temperature plus exposure or history of dealing with sick Ebola patients means quarantine. And this is where discussion between politicians and medical experts should actually take place. Alzheimer's is one segment of dementia. So when someone comes in with memory loss, it's imperative that a good physical exam and history be taken, because there are some reversible causes of dementia. The symptoms can include weakness and nausea, abdominal pain, confusion, and then they start having seizures, which is what happened to the boys. Additives themselves can cause major issues, in fact. And these additives don't necessarily add anything to the drink. It's not been proven that having certain additives like ginseng or amino acid will prove better or be better for you than having the caffeinated drink by itself. Sugar substitutes are twofold. One that have calories and two that don't. All right, and the ones that don't are usually synthetic, and those are the ones where this discussion is really centered around. The ones that have calories in them, we know, are sometimes equal to sugar. It's just that people regard them as more healthy. So our artificial sweeteners are the ones that have been scrutinized for cancer, type 2 diabetes, etc. So the point is not just the obesity issue. There are people with medical conditions who have no choice.